Good morning. Welcome to the National Press Club, the place where news happens. My name is Emily Wilkins. I am the 117th president here at the National Press Club and a DC correspondent for CNBC. Thank you guys so much for joining us, both here as well as those who are tuning in for our headliner event with United States Secretary of Veterans Affairs, Denis McDonough. We are happy to accept questions, and after Secretary McDonough's opening remarks, I will ask as many as time permits. If you're in the room, of course, you can write on the card, but if you are following along live, you can go ahead and email your questions to headliners@press.org and put veterans in the subject line. That is headliners, plural, @press.org. It is now my pleasure to introduce this distinguished head table. Please stand when your name is called, and to our audience, I know all of these individuals are worthy of their own separate applause, but for timing, if you could please save the applause till the end. We'll start with Sean Bullard, who is the CEO of the Duetto Group, and Sean, please stand. Next to him, Jen Markowitz-Wagman, the founder and president of Gen Vets Incorporated. Jane Kang, the director of Policy and Regulatory Services, the National Cemetery Administration. Kevin Wensing, the managing director at Wensing Enterprises, LLC. Dan Flatley, national security reporter at Bloomberg News. We will get to the gentleman next to Dan in just a second. And then right here, Jen Judson, land warfare reporter at Defense News and co-chair of the Headliners team. To my left, we have Dr. Steve Lieberman. He is the Deputy Undersecretary for Health at the VHA. Tara Koop, the Pentagon reporter at the Associated Press. Next to her, Ellen Mitchell, senior defense reporter for The Hill. And then Jennifer Lipschitz, Deputy Chief of Staff, Strategic Planning and Analysis, VBA-VA. Then we have Tom Young, the commander of the American Legion Post 20, the Legion Post affiliated with the National Press Club. And then at the very end, Max Leader, the Stars and Stripes publisher. And now if you want to applause for our head table. It's really a good group today. I think that says a lot about the strength of reporting on veterans and our military in this town. Secretary McDonough has come before us here at the National Press Club every year of his tenure as VA Secretary, and today marks his 4th time, where he has maintained a pledge to be transparent to millions of veterans, and that we will work tirelessly to ensure they are supported. Now, these pledges are inevitably hedged against the tangled red tape of bureaucracy and the fight for limited dollars. But as leader of the VA, Secretary McDonough has made statistical headway despite having to contend with a global pandemic, the struggle to establish and run an electronic health record system, and an expansion of benefits resulting in a record-breaking number of claims that need to be processed. Secretary McDonough has overseen changes in how veterans and their family are helped as they struggle with lasting physical and invisible wounds of war and adapt to civilian life, with a strong focus on mental health care. One example of that is the establishment of the Veterans Crisis Line, which has fielded over 1 million calls since it was opened, but has also been met with some scrutiny. The VA, during Secretary McDonough's leadership, has also provided billions of dollars in toxic exposure benefits to veterans exposed to burn pits and chemicals as mandated through the PACT Act, signed into law in 2022. More than 5 million veterans have been screened for toxic exposure as well. Before coming to the VA, Secretary McDonough served as the 26th White House Chief of Staff under President Barack Obama, as well as several jobs with the National Security Team during the administration. Secretary McDonough has said in congressional testimony that, quote, "There is no more sacred obligation nor noble undertaking than to uphold our promises to our veterans, whether they came home decades ago or days ago." Please join me in giving a warm National Press Club welcome to the Secretary of Veterans Affairs, Denis McDonough. The floor is yours.
Good morning, everybody. Thank you, Emily, for the kind introduction and for leading this very important organization. Let me recognize the Press Club's American Legion Post and its commander, Tom Young, and all the veteran service organizations represented here and watching online. Veteran service organizations are critical to helping us serve veterans. And without you, we just would not be as effective as we are for veterans their family members, caregivers, and survivors. Let me also thank all the journalists who served our country in uniform. I was just talking to Dan Flatley about this, a Marine, son of a Marine. Journalists also, in addition to Dan, like Thomas Gibbons Neff, also a Marine, combat vet, the son of a combat vet, as I understand it from his bio online, who writes powerfully now about the ongoing conflict in Ukraine for the Times. But I have to say I've been particularly struck by Thomas's writing on the end of America's deployments to and the withdrawal from Afghanistan. So I want to be careful here as a non-veteran myself. But it does strike me, and it has struck me, that his writing brought to life the painful experiences that thousands of his fellow Afghanistan vets wrestle with to this day. Navy veteran Zach Badorf, founder of the group Military Veterans in Journalism, is helping ensure more vets go into journalism, a vocation that is so important to our democracy that vets have already sacrificed everything to protect. Zach's getting more vets into newsrooms around the country, improving coverage of veterans' issues, and increasing trust in the media. So to Thomas and Zach, and to Dan, to all veteran journalists, and to all journalists, I say thank you. Veterans Day is right around the corner. So now is a good time to begin preparing our hearts and minds for that celebration. Remembering, recognizing, thanking all those men and women who have fought our nation's wars and defending us during periods of restless peace. And our profound gratitude to veterans goes beyond Veterans Day, because veterans continue serving this country long after they take off the uniform. They've dedicated themselves to building an America that is stronger, freer, fairer for each new generation, that more perfect union we all seek. Anchored by their commitment to service over self, they continue serving this country, always looking out for one another, with their enduring sense of duty, valor, love of country. Veterans set the highest example of what it means to be an American citizen. So at VA, we strive to serve vets every bit as well as they've served and continue to serve us. Veterans Day is a time to renew that commitment, renew what President Biden calls our country's one truly sacred obligation, to prepare those we send into harm's way and to care for them and their families when they come home. Now, as Emily said, when I first spoke at the press club 4 years ago, I had less white hair. It's not in the remarks. And the country was in a historic public health emergency. VA's employees were risking their lives to save the lives of veterans, and, I hasten to add, non-veterans. Despite those challenges, I told you that VA public servants were breaking all-time records, providing more care, more benefits to more vets than ever before. And each year I've come back with a similar report. This year is no different. By nearly every metric, VA's smashing records we had set last year. That means even more care, even more benefits to even more veterans. It's not just more care, it's better world-class care, and it's better health outcomes for veterans than in the private sector. It's not just more benefits, it's faster, more accessible benefits we're delivering by meeting vets where they are, rather than expecting them to come to us. And it's not just more vets. It's more vets trusting VA at rates higher than ever before. President Biden, a military family member, a surviving father of combat veteran Major Bo Biden, has been unrelenting and forcefully demanding in his advocacy for veterans and their families. He spent his entire career fighting like hell for vets, just as he charged me and my VA teammates to do 4 years ago. Under President Biden's leadership, VA has been made into something new, something different. Nowhere has that been more evident than with President Biden's toxic exposure law, the PACT Act. Because of that law, more than 5.8 million vets have been screened for their toxic exposures. Because of that law, more than 740,000 vets have enrolled in VA care. And more than 1.1 million veterans and 11,000 survivors are receiving benefits. The toxic exposure legislation called for a phased-in approach, giving vets access to care and benefits as late, in some cases, as 2032. But President Biden made it clear to me that timeline wasn't fast enough for one simple reason. For too long, too many vets were exposed to harmful substances and waited decades for help. So he directed us to accelerate implementation so all eligible vets and their survivors got the care and benefits they deserve as quickly as possible. That's been life-changing for many families. Life-changing. We can measure President Biden's record-breaking work on behalf of veterans, on ending veteran homelessness, on removing barriers to mental health, on getting vets in crisis the support they need when they need it, and more. In fact, I hope you saw the press release we put out this morning detailing all of VA's record-breaking accomplishments over the course of the past year. But we will never put a value on the countless miracles that have improved and made veterans' lives better. Numbers and statistics can't adequately describe the impact. Dollars and data can't ever really begin to capture and communicate the values, the personalities, the humanity of the veterans we have the honor of serving. So as I prepared for today's speech, I thought maybe those are the very things we need to talk about. So let me tell you 3 stories that demonstrate the impact and the importance of the work that we do, all of us in this room, together. And as Emily just did a minute ago, let me just call out 3 awesome performers at VA who joined me here in the head table because of their unrelenting work. Jane Kang, the Director of Policy and Regulatory Services at the National Cemetery Administration. Dr. Steve Lieberman, the Deputy Undersecretary for Health at VHA. And Jennifer Lipschultz, Deputy Chief of Staff, Strategic Planning and Analysis at VBA at the VA. Those 3 and the thousands of employees that they represent have contributed to these amazing stories. Let me start with Angela Bell. I met Angela in Hampton, Virginia, just last month, September, Suicide Prevention Month. Angela is one of the most generous and courageous people I've ever met. She lost her son, and she has turned her grief into action. So let me tell you a little bit about her son, Sean. Sean knew he wanted to join the military since he was a kid. So determined to enlist after graduating high school that at 17 he got his dad to sign the parental consent paperwork. Sean served all over America, Georgia, North Carolina, California, served all over the world, Korea, Afghanistan, Iraq. Married, had a son, Giovanni, a beautiful name. He earned his bachelor's degree, a master's, a second master's, and he was working on his PhD. He liked to tease his mom, telling her she'd soon have to start calling him Dr. Bell. Sean was the kind of guy who would invite other soldiers over to Angela's house for Thanksgiving because they had nowhere else to go. He'd ask his mom to send him extra care packages while he's on deployment. Not for himself, but to share with his brothers and sisters in arms who didn't get anything from back home. He's an example of the selfless vet I was talking about a few minutes ago. Well, after Sean came back from his second deployment to Central Command, Angela started noticing some changes. Every time firecrackers went off, he'd jump. Being in traffic was overwhelming. Anxious about those other vehicles around him. He was enduring some personal problems, family, health issues, and more. When Angela tried to get Sean help, he refused, worried about losing his clearance. He'd served in the Army for 20 years, and just a few weeks before his retirement in 2021, he died by suicide. I've spoken at many events focused on VAs and our partners' work to end veteran suicide. I've explained that ending veteran suicide is our #1 clinical priority of VA. I've talked about resourcing and about people and organizations singularly devoted to ending veteran suicide. I've talked about data, processes, what we're doing to try to make a real substantial difference, promising initiatives. And I've shared story after story about veterans not just surviving, but getting the mental health care they need and thriving. Yet none of that will bring Sean back or heal his family's heartbreak. None of that gets the enormous tragedy of veteran suicide, gets the powerful, painful emotion. So here's why I'm telling Sean's story and Angela's story. Angela is doing everything she can so that other families don't suffer the same devastation that she did when she lost Sean, when this country lost Sean. I try to be the face of those who are left behind, Angela says. I'm so passionate about telling his story because if it helps one person, whether I know it or not, then I'm doing what I'm supposed to do. People tell me I'm so strong. I'm not. I'm a mom advocating and fighting for my kid. Angela is the president of the Hampton Roads chapter of the American Gold Star Mothers, and she often speaks on our work to end veteran suicide. Thanksgiving, which is coming up, was Sean and Angela's favorite holiday. In his memory, Angela hosts an annual Thanksgiving meal and invites service members, veterans, their families to join her. That gathering quickly outgrew her dinner table and then got too big for her home. This year, Angela's renting a dining hall to host dozens of families from the military community share a warm Thanksgiving meal together. The community she's built has helped Angela heal, and she heals others by helping. So they're not alone. So they know there is always hope. Those are the kind of people we have the incredible privilege to honor and to serve at VA. But we have a lot of work to do to keep our promise to vets, which leads me to my next story. It's almost exactly 23 years ago, October 5th, 2001, when the first U.S. forces arrived at the Karshi-Khanabad Air Base in Uzbekistan, former Soviet air base that we all know now as K2. K2 veterans were among the first to deploy after the September 11th terrorist attacks, bravely conducting and supporting combat missions against al-Qaeda and the Taliban in Afghanistan. They went to a place at K2 that veterans often describe as a toxic soup of exposures, a place unlike other operating bases occupied by American forces, a place that jeopardized their immediate and long-term health. Colonel Gordon Peters, a doc who deployed with those early units, vividly describes what he says was a, quote, chemical odor so intense that it seemed as if someone could light a match, the entire area would ignite. Some K2 vets returned home, developed disabling illnesses and conditions. Their service in those conditions is heroic. Mindful of the passage of time since their heroic service, we've moved aggressively to care for K2 vets since the PACT Act was enacted in 2022. First, we eliminated the PACT Act phase-in period for presumptive benefits, making all K2 vets immediately eligible for more than 300 presumptive conditions. Second, earlier this year, we made all K2 veterans eligible for VA health care, whether or not they filed a benefits claim with VA. Third, after consulting with K2 vets this summer, we've begun rulemaking to make chronic multi-symptom illness, also known as Gulf War illness, a presumptive condition for K2 vets, fixing a gap in the PACT Act. Fourth, For every K2 claim, we've made sure that the unique toxic exposures at K2, that toxic soup, is taken into account, and each new K2 claim gets reviewed a second time before any final decision is reached. Fifth, we've reached out to every known living K2 veteran to encourage them to come to us for the care and the benefits that they have earned and so richly deserve. All of that work has been driven by veteran and survivor advocates, like Peter in the back of the room, reporters, like one sitting here on the stage, and a tireless team of VA employees working on toxic exposure. Some of the best toxic exposure researchers, scientists, and epidemiologists in the world. Because of that hard work, 13,000 of the 16,000 K2 vets are enrolled in VA healthcare. Nearly 12,000 are service-connected for at least one condition, receiving an average of $30,000 a year in earned benefits. All told, K2 veterans now have a higher claim and approval rate than any other cohort of veterans. But we have more work to do to get this right. Some K2 vets still understandably feel overlooked. They've waited for 23 years to see their uniquely dangerous service recognized. I say that again, uniquely dangerous service recognized. So we have to do better and be better for those K2 vets. That's why today I'm proud to announce that VA will begin rulemaking to add bladder, ureter, and other genitourinary or GU cancers as new presumptive conditions for K2 vets and all eligible toxic exposed vets. We're not stopping there. Next week, we'll complete the scientific review of multiple myeloma and leukemias. The preliminary findings are promising, and they suggest that VA will be able to make those conditions presumptive for K2 veterans and all eligible veterans. And once the final results are in, VA will look to expand that presumption to all biologically linked blood cancers. This may include polycythemia vera, or what a guy like I can pronounce as P. vera, a condition identified by K2 vets themselves and shared with VA. We will do so based on biological science and on the results of a PACT Act presumptive process without requiring vets to wait for VA to complete additional studies. And moving forward, I'm committed to establishing service connection for any rare condition found in K2 vets, which has plausible biological link to the toxic soup we now know and acknowledge was present at K2. Because we're a new VA, one that works with veterans for veterans, and one that delivers outcomes for veterans. We'll no longer take decades to consider new presumptive conditions, but will instead use the tools provided by the PACT Act as quickly as possible to proactively establish service connections wherever and whenever the evidence supports it. We put that promise into action in 2021 at the President's direction, might I say, demand, to work on a central command burn pit presumption, nearly 2 years before passage of the PACT Act. We put that into action in 2022 when we established service connection for asthma, sinusitis, rhinitis, and rare respiratory cancers. Again today with GU cancers, and soon for multiple myeloma and blood cancers. We'll continue proving that we are a new VA by using the expedited PACT Act process to look further into that toxic soup at K2. The President considers this, he's made unfailingly clear, unfinished business, and expects VA to establish a presumption of service connection for every condition associated with deployment to K2, and we're committed to doing so. We have to keep listening to K2 vets and all vets. We have to keep fighting like hell for them. So thank you to the vets, the advocates, and journalists who have been instrumental in highlighting the heroes who served at K2. You make us better by holding us accountable. We're proud of our accomplishments and these outcomes for veterans, but we are candid when we come up short. Candid with ourselves, most importantly, but also candid with you, with vets, with Congress, with the American people. American vets deserve our very best and will never settle for anything less. So you should keep holding us to that. Third and finally, let me talk about VA's people, represented by these three awesome teammates up here on the stage, who are keeping our country's sacred obligation to vets. They are the best, most compassionate, highest performing, most dedicated workforce in the federal government, in the entire country. Folks who want to make a real difference in the lives of vets. That's why they came to VA. I'm proud and I'm privileged to be on their team. I'm reminded of that every single day, but it was driven home most profoundly for me when I was surveying Hurricane Helene's destruction in Nashville, North Carolina, a week before last. For over a month now, the Asheville VA, the Vision 6 leadership team, and their incident command team have been working around the clock to support vets and their staff impacted by the storm. Asheville's VA food service employees and the Veteran Canteen Service disaster response team loaded up 2 tons of food and served over 17,000 meals in the first week of recovery efforts, a source of great comfort in the midst of crisis. Their volunteer services have collected thousands of donations from fellow VA employees, and our chaplains, holding candlelight vigils, a space for veterans and VA staff to gather, to be together, supporting and comforting one another during this tragedy. In the hardest hit areas of Western North Carolina, we've identified over 2,600 at-risk vets undergoing chemotherapy, with spinal cord injuries requiring oxygen, diabetic materials and support, and other support. We couldn't call many of them because their phones were out, cell phones and landlines both. So right after the hurricane, VA teams went out to check on unaccounted for vets, to check on them in person. They achieved 100% accountability for all at-risk vets in their care. Given the devastation in those communities, it's quite an amazing accomplishment. And they continue reaching out to vets in the area to make sure they have everything they need. For VA nurses like Melissa Mahaffey and Lisa Sellers, taking care of vets in the crisis is their duty. And it's also about holding tight to hope. Lisa and Melissa have been a pair since starting at VA on the same day 10 days ago. They're Haywood County natives, came to work at VA because they have family members who are vets. Here, Melissa says, it's all about the veteran. The heart of our system is with our patients. When we got a name, we knew these are our people. They're not paying customers. They're not insurance card holders. These are our people, Melissa said. We're going to find them, figure out what they need, and help them. We're going to make sure they're okay. Going out there and taking care of our people, this was our tiny piece of hope. One of the vets they checked on had been without power, and no one could reach him by phone. He wrote us a letter. No one but VA, he said, no one would do something like that. In that moment, there was a human connection that no other healthcare system would have ever thought of. Army veteran, VA employee Corey Anderson feels the same way. Corey was deployed to Kuwait and Iraq from 2005 to 2007. And the devastation he saw in Nashville reminded him of war zones. Corey went to check on one rural vet, drove until the road was gone, washed away. So what did he do? He parked his car in the middle of the road and hiked the rest of the way. He climbed up the mountainside with a pack full of supplies for the veteran's upcoming medical procedure. Corey says, doing this work means the world to me. I'm a veteran. My dad, mom, sister, and so much of our family is made up of veterans. It just means the world to me to do my part. Veterans helping veterans. You guys do it all the time, and there's nothing better. VA employees across the Southeast and Appalachia, people like Melissa, Lisa, Corey, worked long hours through 2 devastating hurricanes, some working multiple shifts, staying overnight for a week at a time in the hospital, risked their own lives to serve veterans, while their own homes had been similarly demolished. Because whether we're in times of calm or chaos, VA's public servants always mobilize around one core mission: saving and improving veterans' lives. And right now, there are veterans at home with their families, happy, safe, and healthy because of them. And I could not be more grateful to each and every one of them. Now, our mission at VA is far from over. There are huge challenges ahead. And as we look to the future, we're going to continue to do better for vets. We're going to continue to be better for vets. The future at VA isn't because of me. In fact, I had asked that this new VA be represented here today at the press club by the best face of our new VA, our Deputy Secretary, combat veteran, the daughter and granddaughter of combat vets, someone who gets her care at VA, and someone who is part of the fastest growing cadre of veterans at VA, women. The VA is new and more effective because of the veterans, the families, caregivers, and survivors we're so blessed to serve, because of the awesome employees represented on the stage by these 3, and because of veterans like Tanya Bradsher, who serve their fellow vets. This future is because of the 451,000 now VA employees in your communities and neighborhoods across the country, your neighbors who keep vets at the heart of their care. And it's because partners like each of you in this room, the VSOs, the journalists. I'll close with a final word to the vets watching today. Your honorable service in uniform sets the example for the rest of the country. You're the keepers of our national ethos. That deep and abiding sense of purpose you learned and applied in serving, your camaraderie, your care for each other, your sense of teamwork that made you stronger together in combat and now in your communities, not riven by your political differences, not polarized by your social media. That is exactly what we need, what this country needs. Your examples are something that all of us can learn from. So again, to all veterans, those here today, those watching, thank you for everything. And to the press club, my thanks for all that you do holding us accountable to veterans. I mostly appreciate it. And telling their stories in the powerful ways that you do. That I always appreciate. God bless you all, and God bless our nation's service members, our veterans, their families, caregivers, and survivors. With that, Emily, let's go to the easy questions.
All right. Well, I will start off because you said the #1 priority has been addressing suicide in veterans. And you recently said there's a relationship between veterans' benefits and reduced suicidality. Can you explain a little bit more about what you mean by that, and what does it mean for how the VA addresses suicide going forward?
Yeah, it's a really good question. What I mean by that is last year, so this is worth taking a minute to get last year's suicide prevention report. We release annually in the fall. Every year it's between September and December. I'm not exactly sure when it will be ready this year. Soon, I assume. Where we get the data and prosecute the data from, which comes to us ultimately from CDC, and cause of death is ultimately determined by CDC and local county officials. So there's a 3-year lag on that. So this year's report will reflect the 2021 suicide data. Last year's report established correlation for the first time between receiving VA benefits, and reduce suicidality. The why is something we're still working on. But it seems to me that there are certain things that we can glean from that. And this is something that I think the K2 vets have helped me understand particularly. That the benefits, actually this happened at a swim meet I was with my son, at one of my son's swim meets one morning too. It was a Sunday morning, I hadn't shaven and had a ball cap on, and I don't grow much of a beard anyway, but person turns around and she says, "Are you VA secretary?" And I thought to myself, self, what are you saying now? And I thought to myself, hell yeah, I'm VA secretary. I said, "Yes, ma'am." And she said something very important. She said that my dad was a VA. Well, my dad was a veteran, Vietnam veteran, and served well into the 80s. And I said, "Well, are you aware of the new PACT Act?" She said, "Yes, and we've filed and we have service connection." And she got very emotional and she said, "I know now that my dad's death was a result of his service to this country. My mom doesn't care anything about the benefits. She cares about that acknowledgement." So, if that acknowledgement is as important as that daughter of a veteran, I think rightly acknowledged, then that would help explain why being in relationship with a VBA has a relationship with lower suicidality. I learned in Northwest Arkansas from this great, I think she was a spouse of a veteran. She said, "Our enemy in this fight is isolation." And she could not have been more right. So maybe that VBA recognition every month and your benefits payments is one of the weapons in our fight against isolation. I can't say that conclusively. What I can say is the fact of the VBA benefits now is correlated to lower suicidality, which is why we are aggressively reaching out to every possible veteran, getting in their lives, finding them where they are, to communicate to them that, hey, we want you to file a claim because we want to be in relationship with you.
I also know that you talked a little bit about setting up the Veterans Crisis Suicide Line, the 988 number. In September, the Congressional Health Subcommittee conducted a hearing on it, and one of the statistics they released is that the VA Crisis Line sees 10 times the suicide after a veteran calls for help. And I know there's also been public criticism of some of the folks who are answering the phones. Can you address these concerns?
Yeah, I'm not sure I understand the statistic. Maybe you can just say that one more time. I don't remember that from that hearing.
It was said they see 10 times the suicides after a veteran calls for help.
I see. Mm-hmm. So I'll go and study the testimony and the transcript to make sure I understand it and make sure that we get in touch with the member who raised it. Here's what we know is that since we've had the Veteran Crisis Line now for decades. Since we turned the Veteran Crisis Line into a 3-number line, 988, and then as a veteran just press 1, we've seen about a 10 to 12% increase in the number of veterans calling into the line. Higher percentages for the number of veterans texting or chatting with the line. Those are coming off of, in terms of, including text, about a 26% increase in the number of veterans in contact with the text line. That's coming off a much smaller base, so the 26% should be considered in context. During that time, response time, notwithstanding this dramatic increase in veteran engagement with the crisis line, has reduced by something like 0.2 of a second, meaning that even with more veterans calling in, response time is staying constant, if not coming down. Second, that crisis line is just one way that we can and have one way we've expanded access to emergency care for veterans. One of the others is called, I've just lost my train of thought, so let me come back to that. On the question of whether there is any causality between a veteran reaching the crisis line and actually resulting in suicidality, what we know now is suicidal ideation, the distance between ideation and action, is very short, can be measured in hours. And so making sure that we have multiple intervention points for that veteran or a family member to insert in that very short period between the start of ideation and action related with ideation is a clinical priority. The second, let me just say, the second one I wanted to highlight is what's called the Compact Act. The Compact Act says to veterans, and I say this to all veterans in the room and all watching, irrespective of your enrollment status at VA, the Compact Act says if you need to see a clinician today, if you are in crisis and need to see someone, go into any hospital in the country, VA, community, private hospital. Let them know you're a veteran. We'll get you that care, and we will pay for that care, okay? In the first year of that, about 50,000 veterans availed themselves of that service, okay? We're about a year and a half now into that new service, but 50,000 veterans in the first year, on top of the engagement with the Veteran Crisis Line, tells us that the demand for engagement in this fight against isolation, in person and telephonically, is huge. Now, as whether there's a question of causality about when the suicide happens, given relationship to the call line, I'll make sure I'll follow up on that.
Appreciate it. And I will also say, if you have written down a question, if you just kind of want to lift it a little bit in the air, and Madison can come around, grab it, and then hand it up to our head table and to Jen. So if you just want to lift your card up, she will come and grab it. I wanted to ask, we are pretty close to a presidential election right now. And I know that there's been a lot of discussion about Project 2025, the Heritage Foundation and conservative platform. I know it touches on a lot of areas of the government. Are there any threats to benefits for veterans under that plan, or any concerns that you have about what the next administration could mean for veteran benefits?
Yeah, I'm going to be really careful to not get into any political discussions, given the statutory limitations of my job. But let me just say that, in the last year, VA provided $187 billion in benefits payments to veterans. Very, very important manifestation of the American people's appreciation for and recognition of and acknowledgement of the service that our veterans have carried out. So I will have every confidence that the people that I work with would fight like hell to protect that manifestation of that benefit and that acknowledgement. And I think I'll leave it at that.
Got it. Well, I know you said you can't talk about politics, so I'm going to ask you another political question now.
Okay.
And I think this one, I would like to kind of frame it in terms of mental health, political extremism, because you are seeing a lot of veterans, and the question uses January 6th as an example, but I think you can even go beyond that when it comes to veterans who kind of adopt some of these extreme ideologies. And I know there are a number of nonprofit groups now that are there to sort of help veterans, but I'm wondering, what should the VA be doing about this?
Yeah, well, look, I want to say that, I get, and I've seen some of the stories about vets involved in certain pieces of this, or vets, receiving disinformation. Sometimes I think we miss the other half of the story. Let me just talk about something that I've only read about in the press, so I can't really verify based on any first-person knowledge, but a group called Vet the Vote, where veterans are across the country volunteering to go act as poll watchers, as poll workers. And who better to do that, as I said in my speech, than people, men and women, who put their lives on the line to defend the Constitution in the first instance. So, yes, there are troublesome stories, some that you've referred to. But there are also really amazing stories, to include the fact that, you know, the Capitol Police who defended the Capitol that day, many of them veterans themselves. Second point, what can VA do? VA can do what it has, can do more and continue what has been a major priority for us, which is to be a source of trusted information. We work really hard to protect a veteran's private communication with his or her provider. We work really hard to make sure that the information that we put out, for example, vets or family members who want to prepare for a moment of crisis can go to va.gov/reach to find pages of information cleared by clinicians, proven to be effective, of how to prepare for mental health crisis. We can continue to be a source of and an island of trusted, reliable information. We can do that, we do that, and we should continue to do that.
We have a couple audience questions. I have one here from Jory Heckman, who's a reporter with the Federal News Network. The VA saw record growth in its healthcare workforce in 2023 to support the growing mission under the PACT Act, but that growth has tapered as the department is still waiting on Congress to address the $12 billion shortfall in its budget. What is the path forward for VA's workforce to keep up with the department's workload? Yeah,
thanks. And Jory's one of those great reporters who covers our business a lot, so he's, you know, was front of my mind when I was thanking you guys. Look, I think as Jory knows, but I'll let you guys know that, you know, kind of the base case of our growth in the VA healthcare would have had us, meaning under the existing funding, would have had us contracting by about 10,000 spots. So going from about 395,000 employees down to about 385,000 employees. With the additional resources we've asked of Congress, we think we can grow that number actually closer to just over 400,000 employees. And why is that? Well, because the demand for additional services, particularly in high demand geographies, and one can see the high demand geographies a lot of different ways, but we see a lot of veteran growth, veteran enrollment in VA care in Florida, Texas, California, Nevada, Georgia, North and South Carolina. Particularly in those high demand areas, high growth areas, we're going to continue to have needs for clinicians and clinicians of all types. And this is a very high demand healthcare providers, especially in particular specialists in healthcare provision, will continue to be a high demand for VA as they are for every healthcare system. So we believe that what we need, Jory, is something closer to that 400,000 to meet the demand, especially in those high demand areas. Now, we're hopeful that as we make this argument to Congress, we'll get their attention and their help, as we have routinely in the past. And you know, we'll see how this plays out over the course of the next month.
We have another question on veterans and housing, and this is from Air Force veteran and White House correspondent, Dr. Matthew Anthony Harper, who joins us today. He says, me and other U.S. veterans are experiencing homelessness, sleeping in our cars, or even on the streets. We can't get HUD-VASH housing vouchers and feel that undocumented immigrants receive favor over housing over us. My question for you, how can you help us homeless veterans more with housing and explain the disparity of FEMA with $640 million for undocumented immigrant relocation and housing, and then only $78 million this year for HUD-VASH veteran housing?
Yeah, well, thank you, Airman, for the question. The thing that we should do in terms of getting you into housing is make sure that we follow up with you after I leave here, and we make sure that we do that. VA, we have outreach. We have homeless veteran outreach teams in every market in the country. And sometimes it takes us a period of engagement with a veteran to establish a trust necessary to get that veteran to work with us to come into housing, transitional housing in the first instance. But we want to then work with that veteran to address whatever the issues were that led to homelessness, be that economic insecurity, unresolved healthcare access questions, untreated substance use disorder questions, to get that veteran then onto a pathway to permanent housing. And the reason to recognize that our goal is permanent housing is because that's what we should expect, and I think that's what veterans should expect in the United States of America. The phrase homeless veteran should not exist in our English language as far as I'm concerned. Last year, we permanently housed nearly 48,000 previously homeless veterans in the United States of America. I'll say that number again. Nearly 48,000 previously homeless veterans were permanently housed in fiscal year 2024. That does not count veterans in transition housing. For example, the veterans in tiny homes on the campus of LA. Doesn't count veterans temporarily in hotels while we work through that transitional housing process to get you into permanent housing. So in every market in the country, if we have a veteran today who's in housing crisis, we, in large measure, can get that veteran into protective housing that night. That's because of an enormously generous appropriation from Congress, supported by Republicans and Democrats. As it relates to HUD-VASH vouchers. HUD-VASH vouchers are a combination of a HUD voucher with access to what we call VA supportive housing. What does that mean? That means access to care, access to counseling, okay? HUD-VASH vouchers are also at the highest level they've been in years. If anything, we do an insufficiently aggressive job of using all of those every month. Those two are a function of a very generous set of appropriations asked for by the president, granted by Republicans and Democrats in Congress. So we're deadly serious about this homelessness issue. I'll talk to you as we leave here, Airman, to make sure we get you into care. And I had the question, so that's good.
We have another question from the audience. You stated that although you record higher satisfaction with VA care, you noted that Black veterans and women still aren't satisfied with care. How are you addressing that?
I didn't say that, but that's actually a fair, I think that's a fair, I'm sorry? Yeah, oh, I thought you said I just said it today. Yeah.
Sorry,
yeah.
question
Okay.
was today, comment was.
Okay, great. Yeah, what I've said in the past is that the veteran trust rating is a very important tool. Let me just shout out VA. Somebody like Steve Lieberman, immediately to Emily's left, who's done an amazing amount of work on that patient satisfaction survey rating, which has been in use in VA now just under 10 years. And I give a lot of credit to Secretary Bob McDonough for bringing that survey to life at VA, along with Steve and his teammates. A veteran, after an engagement with us, will receive a survey. Veterans fill out that survey in somewhere between 12 and 15% of cases, which is very high end for healthcare patient satisfaction survey participation. And we now have years of data. So that data is a very rich source of information for us. We are now applying that survey data across VA functions, including now the compensation and pension exam process. so that we can get similar veteran data from that experience to help improve our scores. Across all metrics of VA on the veteran satisfaction score, we're at the highest level we've ever been. In terms of outpatient care, about 91.8% satisfaction from veterans. Overall satisfaction, about 80% satisfaction for veterans. Both highs, historic highs in the 8 years that we've been collecting this data. Period. Next paragraph. However, the more diverse, both by race and by gender, the veteran, the lower the satisfaction. That's the beauty of the survey. It allows us to understand the specific experience of veterans so as to inform our pathway forward. So what are we doing about that? Well, we are aggressively, we just had our Center for Minority Veterans in California for the NAACP conference over the weekend. We had a claims table. We had VHA providers at that conference. That's just one example of us, as I said in my remarks, trying to make sure that we bring VA to veterans rather than expect veterans to change their life to fit into VA's programming. So that's one thing we're doing. Second thing we're doing is we're making sure that as we hire, we're hiring the kinds of providers that reflect the diversity of the VA's patients' complex medical needs and the complexity and the diversity of VA's patients. For example, we need more gender-specific providers. What we know is that veterans of reproductive age, of childbearing age in VA have more complex health situations than their non-veteran peers. They have pregnancies at older ages than their non-veteran peers. So we have to have more experienced gender-specific providers, especially given what we know about the wide range of experiences of women of color with pregnancy complication. Third point, VA and countless other studies have shown, for example, a black veteran who's seeing a black cardiologist has higher outcomes on, for example, preventative interventions on cardiac conditions than a veteran who's not being seen by a black doctor. So all of these are indications that we have from data that show we have to have a VA healthcare team with the experience, the expertise, the specialties, and the reflection of that very diverse patient group to ensure that we have best outcomes.
Well, I know we have a lot more questions. Unfortunately, I believe we are at time, regrettably. Thank you all for everyone in the audience who did submit questions. We do have one final one,
Okay.
Mr. Secretary, but before we do, I did want to take a moment to thank the organizers of today's event, headliners, team leaders, Donna Lanliger, Lori Russo, and Jen Judson. Also a special shout out to Kevin Wensing, who is Kevin Wensing, who is the one who coordinated the event today. We also have Club Program Manager Cecily Scott Martin, Club Membership Director Kate Helster, and Club Executive Director Didier Soji. It's also my honor to present Secretary McDonough with the much coveted National Press Club mug. You now have all four.
Thank you very much.
And for your final question, and I've gotten this one twice, so I am going to ask for it. What is next for you when your service with the VA as Secretary ends?
Yeah, thanks so much. It's, I don't know what's next for me. We'll see. What I do know is I have an amazing wife and 3 beautiful kids. And I know that at least one thing is to make sure that I have a nice supper with my wife and my kids, if I can convince them to come join us. So when I have more to say on whatever comes next, I'll let you know. But in the meantime, we got an awful lot of work to do at VA. And I appreciate all your all's help in making sure that we do it well. Thank you.
Thank you so